That's how you do a type 1 muscle energy treatment for the thoracic spine. So when we do thoracic muscle energy, I prefer to have the patient sitting with the legs off of the side of the table because you can choose your side more easily, right? So if he was sitting with his legs over this side, it might be a little harder to maneuver because the table's blocking you if you're trying to stand right here. So if he was rotated right, I'm going to exaggerate it, side bent left, we want to stand opposite the side of that rotation for a type 1 muscle energy. Since it's like 1 to 4, we're going to treat in the middle of that group. So I would say around T2 over T3 would be fine. So we want to monitor always, right? So I'm going to monitor on those transverse processes here. And what he's going to do is he's going to cross his arms, cross like this, okay? If you want to come over to the front, you can see. So as I'm monitoring here, all right, for type 1 dysfunctions, remember, wonder. 1, you go under that first arm and over the second. And what that does is if I'm standing opposite the side of rotation, all I got to do is pull towards me. And that's going to rotate him left and side bend him right. So that's already setting him up into that barrier according to his diagnosis. Because remember, it was rotated right and side bent left. Okay? So what we do is I set him up and then I tap his arm and just say, slowly turn to the right against me. 3, 2, 1, and relax. And then we reset a barrier, rotation left, side bending right. Remember, this is PIR, so he's contracting into his diagnosis. One last one, turn to the right. And then we do just one final stretch and back to neutral. And then we always retest, so arms down to your side. And he is moving better and more symmetrically.